Is your urine silently screaming symptoms of kidney disease? And today I'm giving you 5 warning signs and symptoms on how your urine can reveal dangerous kidney problems. Over 35 million Americans have kidney disease, according to the CDC, yet most don't even know it. 9 out of 10 people with kidney disease have no idea that they have it. This means that by the time their doctors refer them to me for treatment, the patients are in shock. Don't worry. There are ways to stay ahead of the game. There are ways to pick up clues that you might be having kidney disease. 5 warning signs and symptoms on how your urine can reveal dangerous kidney problems. Question: did you know that your morning urine color can let you know if you're dehydrated? Let me know in the comments. Number 1, changes in urine color. Okay, so your urine should be a very pale yellow or amber color, okay? It should be pale. If your urine is dark, that could be an issue. Okay, so if you have dark urine, dark yellow, even brown, it could mean a few things. 1, it could mean that you're not hydrated. If you're hydrated well, if you're drinking adequate amounts of water, then your urine is going to be that pale yellow color. So when you look at your urine, if it's dark, the first thing I want you to think is, oh, am I hydrated? The other thing that a darker urine could mean is infection, okay? If you have a UTI or urinary tract infection, oftentimes the urine will be dark and it will even be cloudy. It often has kind of a foul odor to it as well if you have a urinary tract infection. So yes, dark urine can be giving you that hint as well. And then let's talk about the other colors. What if your urine is brown, like a Coca-Cola color? That could mean that you have blood in the urine. Yes, even if it's not bright red, if it's Coca-Cola colored, that could be a hint that you have glomerulonephritis or an inflammation of the kidney cells. And that's very, very serious. It can mean that you have a post-infectious glomerulonephritis. So let's just say you had a strep throat and then you ended up having a Coca-Cola colored urine. That could be a hint of kidney disease from this color of the urine. It could also mean that you have something called IgA nephropathy. You could have lupus nephritis. You could have any number of problems, but if it's a Coca-Cola color, you definitely need to see your doctor immediately because it could mean that you have some very serious inflammation and kidney disease. Say your urine is red. Well, I mean, that would probably wake you up. That would be a big shocker. But if you have red urine, yes, definitely, it could mean that you have blood, bright red blood. And it's serious because if it's still red when it hits the toilet, you're probably having an active bleed, okay? So it could be bladder disease, or you could be bleeding from the kidneys rapidly, and you could even have cancer of the kidney, renal cell carcinoma, or you could have something that's happened to a vessel that has caused the vessel to be disturbed or the vessel to burst and you have bleeding. Either way, that's an emergency. You definitely want to contact the emergency medical system. Call 911 if you have bright red blood in the urine. You could also have bright red blood if something is going on in other parts of your urinary tract system, like, again, a bladder infection, a bladder cancer, a tear in your urethra, which is that tube between the bladder and the outside world. Either way, if you have red urine, you need to be concerned. I will say that there are certain foods that can give you red urine, like beets, but you want to make sure that you're safe rather than sorry and check it out with your physician. Another change in the urine color is if it's literally white, like white bubbles, like foam in the urine. Yes, foamy urine could be an indication of kidney disease because it often means that you're leaking out protein in the urine. Now, it's normal to have 0 protein or very, very low amounts of protein in the urine. But if you have high amounts of protein, then when you look at the toilet, your urine might bubble up. And I don't mean just a couple of little bubbles when your urine hits the toilet. I mean foamy urine, kind of like if you see those beer commercials and there's a lot of foam on top of the beer as it comes out of the tap. Yeah, I'm talking about some foam that you can't deny. Other things that could potentially change the color of your urine are, the foods that you're eating, like we discussed, also vitamins that you take. But either way, if there's a change, don't just sit at home and guess. Call your physician right away because a change in urine color could be a warning sign that something dangerous is going on with your kidneys. Question: when's the last time you actually looked at your urine color? Was it today? This week? You can't remember? You never even thought about it? Please comment down below. I want to know. Number 2, frequent urination. Yes, I know that might sound counterintuitive because a lot of my kidney patients will come to me and say, how can I have kidney disease when I make a lot of urine? I mean, I go frequently. Well, guess what? Frequent urination can actually be a warning sign that you have kidney problems. So yes, there are lots of things that can account for changes in how frequently you urinate. Your age, your gender, certain things that you drink. So of course, if you have a high fluid intake, you might urinate more frequently. Or if you drink a lot of caffeine, that can make you urinate frequently. Also, certain medications, if you're taking water pills or diuretics, you might urinate more frequently. But frequent urination can also reveal kidney problems. Case in point, if you have a UTI or urinary tract infection, you might develop urinary frequency. You start going more frequently than normal. And normal is considered to be urinating anywhere from 4 to 10 times a day. Yes, that's a big range, but you probably know what's normal for you at this point. But yes, anywhere between 4 and 10 times a day of urination is considered in general to be within normal range. But if you have a UTI, you may have to keep getting up, going very frequently, more than even the 10 times a day or more than what's normal for you. You might also experience urinary urgency. feeling like gotta go right now, but you get there and you really don't have to urinate. Other things, well, it can mean that there's a problem with the anatomy related to your urinary tract system. If you are a man, for example, and you have nocturia, meaning you're getting up a lot at night, not just 1 or 2 times, but you're getting up frequently, you're urinating frequently at night, that could be a warning sign that you have a big prostate or BPH. So make sure you talk to your doctor, men folks, if you're having nocturia and you're urinating frequently at night. Urinary frequency may also be a warning symptom that you have an overactive bladder. And that can be true for both men and women. It can mean there's an issue with the nerves in the bladder, with the muscles in the bladder. It may also be a central nervous issue. So you definitely want to see your doctor about that. Now, here's the surprise. Frequent urination can also be a sign of CKD, chronic kidney disease. Yes, you might be making a lot of urine, more urine than normal, but it could mean that your urine is not concentrated. Your kidneys are not concentrating the urine properly, and that's why you're getting an overflow of urine and urinating frequently. And so again, it may seem counterintuitive, but having frequent urination may actually mean that you're having a decreased urine function. Oh, and another very important thing to know about frequent urination, it could be a sign of diabetes, diabetic nephropathy. We know that there are many warning signs and symptoms of diabetes, but getting up at night, having that nocturia, urinating frequency can be an issue, because if you have diabetes and you have high blood sugar or hyperglycemia, your body's going to try to get rid of that sugar. And when that sugar flows through your kidneys and into your bladder, guess what? It pulls a lot of water with it. And so it can be a warning sign of diabetes. And that's important as related to kidney disease, because diabetes is the #1 cause of kidney disease. Number 3, pain or burning during urination. Now, you know good and well that pain when you urinate is not normal. So if you've had it and you've gotten used to it, get unused to it and see your doctor, because painful urination can mean a lot of things. Of course, the first thing that jumps to mind is a urinary tract infection, right? If you're having pain or burning in the urine, also called dysuria, you want to see your doctor, have a urinalysis and a urine culture to make sure you don't have some bacteria that's brewing up in there, because that's something that generally is pretty easily treatable. Pain during urination may also signify that you have kidney stones, okay? If you have kidney stones and you have this urine flow that's causing the kidney stone to move, well, that kidney stone might be scraping the inside of your kidney as it moves on down, and this could cause a pain during urination. Classically, kidney stone pain will be in the flanks, okay, in the lower back on the side where the kidney stone is, and it will often radiate or move toward the front to your groin. And if you urinate and these kidney stones are moving, yes, that could cause pain during urination. You could also have pain during urination if you have some obstruction or blockage. Again, for men who have large prostates or BPH or even prostatitis, they may get a pain when they urinate. Also, if you have a blockage, then you might urinate, but you don't completely empty out your bladder. And so you may feel a fullness in the lower front part of your belly or the kind of upper front part of your pelvis. And so obstruction or blockage could lead to pain during urination. I will say that typically chronic kidney disease or CKD, it's usually painless, okay? You don't necessarily feel pain in your kidneys or pain when you urinate just because your urine function is decreasing. But if you have things like kidney cancer, again, kidney cancer can also be silent. It can be pain-free, but in some cases, a large kidney mass can cause a pain when you urinate.